Yes, it's a technique that's really developed from diagnostic ultrasound, and that the ultrasound transducers that are used to diagnose abnormalities in myocardial blood flow with ultrasound contrast agents can also be used to improve the myocardial blood flow to those specific regions that are targeted to that intermittent high mechanical index impulse that's used to clear the microbubbles from the microcirculation. So in essence, it's a diagnostic technique that's been modified slightly to improve microvascular flow to areas of obstruction. In this particular case, in acute myocardial infarction, where after an acute myocardial infarction, there's still treatment with the percutaneous coronary intervention. Even though that may look like a good result angiographically, there's still serious microvascular flow abnormalities, and the ultrasound imaging techniques with microbubbles can be used to quantify the size of those defects. Yes, I think this is a very important question, because even though we have several large multi-center investigations demonstrating the safety and efficacy of ultrasound enhancing agents in detecting and improving patient outcome in the acute care setting, it's still grossly underutilized in all parts of the world. The ability of the ultrasound enhancing agents to improve patient outcome has been shown by several investigators in the United States and beyond the United States, that have shown that if you give the ultrasound enhancing agent within 48 hours of coming in a patient with a critical care illness, their outcomes are improved. So I think now it's just a matter of education, getting more people trained in using the ultrasound enhancing agents, and promoting their usefulness in this setting, and getting it more involved in fellowship programs. That it's mandatory to have a very familiar understanding of how to use the ultrasound enhancing agents in several critical care settings. It was a very exciting session in which there were four finalists, all of whom were young investigators who demonstrated new and potential applications for ultrasound enhancing agents, specifically ultrasound perfusion with ultrasound enhancing agents using the very low mechanical index imaging techniques to improve patient outcome and diagnostic capabilities. The winner was an investigator who has shown that in acute coronary syndromes that are not related to ST segment elevation myocardial infarction, ultrasound enhancing agents and ultrasound detection of perfusion can identify the culprit vessel in these situations and guide interventional techniques and monitor the effectiveness of those interventional techniques. This is a very exciting application because we know that non-ST segment elevation myocardial infarctions are much more frequent than ST segment elevation myocardial infarctions, and the potential there for the ultrasound enhancing agents is quite large. The other investigators presented on the ability of ultrasound enhancing agents to detect myocardial bridging abnormalities and abnormalities in myocardial blood flow, and the ability of ultrasound enhancing agents to detect hypertrophic cardiomyopathy, microvascular perfusion abnormalities in hypertrophic cardiomyopathy. And then the fourth investigator demonstrated in a large retrospective analysis of patients with microvascular obstruction following ST segment elevation myocardial infarction that ultrasound enhancing agents and the examination of myocardial perfusion in these settings, microvascular perfusion in these settings, definitely identifies the patients at highest risk for adverse outcomes and ones that we really need to focus our therapies on. I think that ultrasound has obviously a bright future in and of itself because of three-dimensional technology and strain imaging. All have the potential to improve our detection of severe valve abnormalities and abnormalities in myocardial systolic function. I think the use of ultrasound enhancing agents has an even brighter future because of its potential to examine perfusion and wall motion at the bedside. This currently cannot be done by any other technique. MRI obviously requires the patient to go to the scanner, is very limited in its availability, and nuclear imaging is only a technique that analyzes perfusion and not really wall motion simultaneously. It can do wall motion, but well after we need it, like during peak stress. Ultrasound has the ability to detect both myocardial perfusion and wall motion at the same time. And that ability to do that will provide important beneficial effects in the future, we believe, in detecting coronary artery disease at the bedside and monitoring therapy. That, I think, is one of the biggest applications. The artificial intelligence is another area where echocardiography will have great potential to be utilized for deep learning, and in the area of myocardial perfusion imaging with ultrasound enhancing agents, it will be able to not only develop teaching algorithms, but allow us to develop software that will be utilized for analyzing perfusion automatically at the bedside using the techniques we know already and the large databases we have available to us for both rest and stress perfusion. Yes, this is a very important question because we want to be able to extend these exciting new leading edge applications of myocardial perfusion imaging with echocardiography and this analysis of wall motion and perfusion to areas where remote access, where clearly expensive techniques like nuclear and MRI and CT would not be available. And ultrasound enhancing agents with the current smaller, more miniaturized systems that allow us to do perfusion imaging will be very helpful in these locations to provide high quality ultrasound images and assessments of myocardial perfusion and wall motion simultaneously with the ultrasound enhancing agent at the bedside, well into remote areas where larger, more expensive techniques would not be available.